Direct from Foxborough, Massachusetts, the gem of Norfolk County, and taped at the studios of Foxborough Cable Access. It's Foxborough Central, and here's your host, Bob Hickey.
Welcome to another great episode of Foxborough Central. I am Bob Hickey, your happy host, here to talk about the events, organizations, and people that make Foxborough the gem in Norfolk County. I am joined once again by my friend Joe Rolanitis. Joe, thank you so much for coming down from the FDA, Food and Drug Administration offices outside of Worcester, Massachusetts.
You've got us located, Bob. Now they know where we're at.
And you know where we're at because you've come down here a couple times and shared FDA initiatives, FDA programs. But today we're going to talk about the FDA and the flu. A timely topic and one that at home, I hope if you're watching, you're not taking a sick day from work because of the flu. I hope that you're thinking about being prepared for flu season and maybe getting an injection, an inoculation, maybe just making sure you wash your hands, maybe staying away from all those people, locking yourself in the basement, making sure that nobody with the flu comes at you. Is that the way to go about it? Lock ourselves in the basement, make sure the flu doesn't come to us?
It's a little bit theatrical, but I think it's good for TV. It really works. Getting the message across. Yeah, it's that time of year
we'll check
again.
the ratings and see if it's good for TV.
I'm hoping it works. I can't wait for the movie. It's an important part of the year, and we count beans in the FDA. And we looked at the last 35 flu seasons, 35 years of the flu. And on the average, about 5 to 20% of our population gets the flu at any one time.
That high?
Yeah, I'm hoping the folks here in Foxborough are going to go out and get their flu shot. We'll talk about that in a moment. But of those 5 to 20%, on the average, Bob, and this is probably not the humorous part of the equation, is between 3,000 to 49,000 Americans die every year, depending on the season, how severe the flu is and how prepared we are from the flu. So it's a real major concern. It's huge. It's really huge.
And I think that's it's a good point to bring up. I use humor in the program, but this is a serious issue, and I'm so glad that you came down from your offices to talk about it with us today, because the flu, while I had a great grandfather pass away in the flu pandemic of 1919.
Of course.
It's not an issue to be taken lightly. And I remember in the 70s getting my swine flu inoculation,
Sure. Yeah.
And now we're talking about the H1. I can't even talk all the acronyms that they use these days. But how serious of it is an issue is it as far as can the flu this year be dramatically different, worse, better than any other year?
Great question. And it's, Bob, it's always unpredictable. We just don't know. And you mentioned the swine flu of 1918, 1919. 500,000 Americans died because of that. Millions more in Europe. And that came over from GIs coming back,
Correct.
as you know. That's probably part of your family folklore, from France at the end of World War I. Major thing. I think it was, a sizable section of our population got sick with the flu. How serious is it? It's always something to take very seriously. We look at the flu epidemic in the southern hemisphere, and we prep and prepare the inoculation for that.
Because the seasons are
That's
opposite.
correct.
And so trending, you would see it start down there, and then it would fly up here during that off season. They probably do the same thing on their end.
I'm sure it's reciprocal. So the vaccine.
But how similar is it? Is it a proven model that works, or?
Great question. It is. Usually it's pretty much on target. There's always some variation in the theme.
We can't just close the equator and not let anybody come north.
So much for Brazil, huh? But anyways, no, we can't do that. But we can prepare. And I mean, in the past, there have been concerns about shortage of flu vaccine because of regulatory actions.
You hear about it, manufacturers having to ramp up production.
That's correct. That's correct. It's always a concern. This year, it's a little bit early, but no problems with supply. Supply is there. We're looking at the strains of the flu. Don't think there'll be anything, I could be wrong, but don't think there'll be anything different from the year before. I mean, the common denominator in this equation is how to make sure that people realize the need to get the flu vaccine. There's lots of fears out there. There always has been, always will be.
Flu vaccine. Do I need it?
Exactly. Succinct, hard-hitting news. You do. You really do. If you're 6 months to like 95 and you don't have a compromised immune system, which means you're really, really sick, and you check with your physician or nurse practitioner or healthcare provider, you should probably get the vaccine. The sooner the better. You can always get it. You can go right to the last day of the official season, which is probably late April. You can still get it, but you should get it. You really should. It's important. It really is.
So you always hear a few people saying, "Oh, I didn't have the flu until I got the vaccine, and then I got the flu." Is there any truth to that? Can you contract the flu from getting the flu vaccine?
Well, it's a consideration, but fortunately, it's not true.
It isn't, but it sounds great.
And we're gonna diffuse this. It does sound great.
So last year, my entire team went and got the flu inoculation at work, and then they all called in sick the next day. They were just pulling my leg.
They were. They were being quick. They were. It's Yankee ingenuity.
They got one over on old Bobby, but I'll get you back this year.
There you go. No, it's what a group. Creative. It's a dead.
It has nothing to do with their leader.
They took it from you. It's a dead virus, so you can't get it from getting the virus.
The vaccine is a dead
it is.
virus.
There's no live virus in there.
So you cannot
You can't.
get the flu.
You can't.
So you've now debunked one of the great myths.
I'm working on it.
Foxborough Central is rocking today. I got to tell you, folks, you should pay attention.
You guys are leading the way in modern medical mythology, I guess, or diffusing same.
I'm liking it.
It's a good thing. I mean, if you pick up the flu, maybe you got the shot too late. That could be a possibility, so that you already had it when you got the vaccination.
Well, I suppose that during flu season, when you get the flu shot, you have already stood the risk or the opportunity to catch the flu. What is the incubation period for the flu?
You know, I don't really know that. I'm guessing. I'm not going to speculate. I don't know it, but you can catch it in a couple days later. It's rolling in your system, and you got the muscle aches, the cold, the stuffed up nose, headache. It's a lot more extreme than a regular cold. You know that as well as I do. We've all had it. It's tough on you. So that's a major concern. Yeah, there's plenty of vaccine, and there's really a need for everybody above 6 months. If they're a pregnant woman especially.
You can get the vaccine if you're pregnant.
You can. Okay. You can. You should. I mean, just the ramifications of getting the flu. Once again, always check with your physician if you have a pregnancy going on, because there are many things about a pregnancy that you have to monitor. So that's guidance there is really important. But there is just such a need we have 300,000 hospitalizations every year because of the flu. It's a drain on resources. It's uncomfortable.
300,000.
Yeah, that's a lot. There's a lot of people sick. Yeah, really sick to go to the hospital. And you know what? And for a couple of weeks, you're not on your game. It's just not a good thing. If you don't mind, I'd like to address fraudulent flu products. You know, we are internet people. The internet is a wild west of information. There's a lot of stuff out there.
Folks, Joe Rilanitis, our public relations guru with the Food and Drug Administration, is going to lay down some heavy truth. Let's pay attention.
It is heavy truth. You can go on the internet and you can get a lot of information. You can. And a lot of it is somewhat deceptive. Health fraud regarding flu products has really come into its own in the past 3 or 4 years. And the way I can credential that or back that up is that I get a lot more traffic from my people down at the Center for Biologics and my leadership element down in White Oak at our headquarters about fraudulent flu products. You've really got to be careful of that. There's no miracle cure for the flu. And there's no flu product that will make you immune unless it's a traditional medication that the vaccine that you get when you go to your CVS or your health clinic and whatever the case might be. So that's the most effective precaution to prevent you getting the flu is the vaccine. Okay. All these other things, Bob, that you find on the internet are false marketing. They're fraudulent health items. They can't back it up. There's no scientific data. Even holistic products that make great claims are not your traditional clinically approved medications that are the way to get vaccinated to prevent the flu. So I need to drive that message home because we're just finding that to be more challenging.
And of course, with late night television and commercials being cheaply bought, you see a preponderance of miracle cures, and this will will cure the common cold and the flu,
Sure.
and will help you grow hair.
Sure.
And I guess that's an interestingly definitive statement that was unexpected. You're saying that the flu vaccine is essentially the only preventative measure you can take for combating the flu.
And besides chicken soup, or that's after the flu, I
Right.
think. Yeah, it really is. It's your clinically, approved product, looked at for a long time. Credible drug companies that manufacture it, we inspect. We have high criteria, proven to be effective. It's a major thing. Someday in the future, maybe during the cold winter months, we can do a whole show on health fraud. I have all these interesting visuals, which TV loves, that I can spread out on this table. We can go through them one by one and talk health fraud. So really, it's somewhat of a funny equation, but it's very serious. And the people that...
What's serious is also a little sad in that there's
is.
still such an industry trying to, and there's a sucker born every moment, as we all know, P.T. Barnum. But it's a shame that is a still ongoing area of, I don't want to say concern, but just a reality that you
Right.
can't trust.
Never go away, Bob. It will never go away. It's always, snake oil salespeople have always been with us, and they always will be. They'll adapt the technology from the back of a wagon or an old car to the internet, but they're always with us. And the real shame here, when it comes to the seasonal flu, are the facts that I mentioned, that we can have as many as 40,000 people dying a year because they didn't get the flu vaccine. If some of these people, even a small percentage, bought into the fraudulent flu products out there and died or got very sick because of it, it's a tragedy. It's a real tragedy. And that's something that I find sitting in the information spot with the Food and Drug Administration is something that's worth crusading against. It really is. I have a real strong dislike for fraudulent claims on products that don't do what they say they're supposed to be and get people real sick or cause a death or serious injury.
Absolutely.
Not acceptable.
Well, I'm really glad to know that the Food and Drug Administration is not only on the job, but you're willing to come out and give such definitive statements. It's refreshing to see that not only do you feel passionately about it, but it's a definite no-no as far as the fraud and the issues that surround the flu and flu season, and a vaccination is really what needs to happen.
Sure, well, and well said. I advocate that everybody, if they're that 6 months and up to like 98 or whatever the case might be, fit the proper criteria, go and get their flu shot. Do it early, or do it at least. Do it before you get the flu. Get your flu vaccine. It's credible. It works. Sometimes you feel a little drowsy or a little sore at the injection spot, and sometimes there are. There are side effects on many medications, and it's usually announced in the patient package insert. But by and large, the flu vaccine is a wise healthcare choice for the individual and for the family, for anybody in the country. You don't want to be a stat that I have to talk about on great shows like this, but those are negative stats and they're no fun. So you get 5 to 20, 25% of the population coming down with the flu at any one time. We would like to reduce that to less than 3%. That'd be really nice. And the way you do it is make sure that people get out there and get the vaccine. I've seen the signs at retail stores, the drug stores and the major big box stores.
Yep.
They're pushing it already.
Well, I was just going to say, Joe Relanitis with the Food and Drug Administration, we only have 1 minute left. You're going to get the last word, but I'm going to share that in addition to, of course, contacting your doctor and arranging for a flu vaccine, or with the Council on Aging, contacting Vicki Lowe to talk about when their supports are in place. We have pharmacies here in town, Walgreens, CVS, and also, as you say, big box stores. And there's many avenues, including many of our employers, offer flu vaccines. And what on earth is there that the Food and Drug Administration is concerned about with the flu vaccines?
Older Americans, and of course you have senior workers on your staff right here in the studio as we speak. 65% of the people that die from the flu, from not taking the flu medication and getting the seasonal flu, are senior citizens. 65%. So they make up and they're a great resource. They make up a huge part of the seasonal fatalities. So get everybody out there, get your seniors out there, and do the right thing for your family.
Joe, thank you so much for
You're the
coming
best,
out and
Bob.
talking to us. Foxborough and the flu. Don't buy into the fraud. Don't forget to get vaccinated. I'm Bob Hickey. Enough said. Take care.